Hey everybody, this is Scott Sykes, Democrat for State Senate here in our 31st District. This makes up Elliott, Lawrence, Martin, Morgan, and Pike counties. Welcome to our second part of our video, or I guess second installment. That would be the appropriate thing to call it, all right. So this is the second installment of our video series where we're talking about my platform. The first part we spoke about the economy, which is the first plank of my platform. In this part, we will be talking about healthcare and the impacts of healthcare on our region and why we need to have someone that's going to be in Frankfort who understands the importance of the Kentucky Health Benefit Exchange, who understands that we need to ensure that every Kentuckian has access to affordable health care and the importance of that. Here I have my sister with me, Stephanie Richards. She's going to kind of be guiding us through and be somebody to bounce off of and move the conversation along whenever I get hung up on talking about something and standing up on my soapbox. But anyway, we're going to be talking about healthcare. So let's do it.
So it seems, in reading your platform, it seems like there are four major areas. There are many points of the healthcare platform, but the four main areas of your platform, I would like to start. I would like to start with an overall idea of why do we need healthcare? Because in Kentucky, we've gone a long time without healthcare.
Yes.
We don't always understand that healthcare is a right versus a luxury.
Mm-hmm. Well, again, that goes back to the gritty, spirit and of mountain people.
Right.
You think about some people that it's just like, it'll be all right.
Right.
I'll just walk it off. And you have grown men that have worked themselves to death in the mines, walking around with broken bodies, because of that mentality. Walk it off. I'll be all right. I gotta work. And that's kind of ingrained in our culture.
Mm-hmm.
But healthcare is a right.
It is.
And the one thing that we have, and it's kind of a new thing. Governor Steve Beshear introduced it, and it came around with the Affordable Care Act. All right, as some people also call it Obamacare, but it was the Connect is what it was called. And that opened up a marketplace so that people who fell in a donut hole, who were employed, didn't necessarily qualify for Medicaid, but they wanted to buy into Anthem or one of the healthcare providers in the network, and they just had the opportunity to buy into it.
Mm-hmm.
And so that opened up a marketplace and made it available for people who wanted to get that health insurance could do it instead of it just being dominated and monopolized by private health insurers.
Right.
But still, these were private health insurance companies that were part of the marketplace, but they were negotiating price and everything like that to be able to be part of that marketplace.
Mm-hmm.
So when you look at healthcare in East Kentucky, you see a whole lot of people have the three main health issues: obesity,
Mm-hmm.
type 2, diabetes, and heart disease. And one of the things that we have to do and make the shift by providing health care and access to affordable health care to everyone is the preventative care, so that it's not always a trip to the emergency room when you're sick. And preventative care, that includes being able to have glasses.
Mm-hmm.
That includes being able to go to the dentist. Those are some basic needs right there. But it also includes being able to, see a cardiologist before you have a heart attack. To be able to, have affordable prescription drugs, instead of being paying way too much for them. Those that suffer from type 2 diabetes, insulin being part of the main issue. And really, where we are right now with health insurance and prescription drug costs, and I talk about it in my platform specifically, are the pharmacy benefit managers,
Mm-hmm.
okay, or PBMs. Now, most people out there don't have a clue what a pharmacy benefit manager is. But I will tell you, it is there is zero effect on patient outcomes from pharmacy benefit managers being in place. And by pharmacy benefit managers, I'm talking about CVS. Now, it's not the CVS pharmacy. These are people that are managing the insurance payments and the money that the insurance pays to the pharmacies, and they're taking a cut of that and driving prescription costs up because they're taking a cut of those of that exchange.
Mm-hmm.
And they serve absolutely no purpose.
They're creating a middleman.
It was a created middleman, and they make billions of dollars over the processing of insurance payments to pharmacies, instead of the insurance companies and pharmacies dealing directly with each other. So and that has driven up, here in the United States, that has driven up medicine costs,
Sure.
costs for prescriptions. But when we look at healthcare overall, we have to look at the access that we have, and access and coverage are two different things. So we have Pikeville Medical Center, which is a phenomenal facility. Okay, who can afford to go there if you don't have insurance?
Mm-hmm.
Right? So that building has no value to a person, even though it has all the resources, great doctors and everything like that, has zero value to a person who can't go there because they can't afford insurance. And surely, if they don't have insurance, they can't afford the enormous medical bill that they're going to be getting to go there for emergent care.
Right.
Because that's the only time that people without insurance show up at a hospital. They're dying,
Mm-hmm.
So, or they're in a lot of pain somehow. But that's where we are right now. So it does come down to dignity and quality of life. Every person deserves health insurance and affordable health care, because health care is a basic human right. And that's where we are.
And affordable health care is doable.
Well, yeah. I mean, the VA shows that.
Mm-hmm.
All right, and I mean, and yeah, some people will scream and holler, no, it's not, because I'm having to do this, or I'm having to do that. I still haven't got my VA benefits. Once you get your benefits, though, you for the most part, you're in pretty good shape. And again, you're looking at Medicaid, all right, Medicare, the VA. All three of those programs have immense bargaining power whenever it comes to dealing with prescription drugs with these drug companies, and they also have immense bargaining power when it comes to being able to provide better patient outcomes for those that are in their networks and part of their system. So that's kind of where we are with those. I mean, you see those big three, and no one who's in those systems, all right, won out. Like I remember whenever the Affordable Care Act was being brought up and everything, and the lady said, the government's not going to take my Medicare. government was your Medicare, you know, and that's, and there's been so much misinformation put out to try to, you know, get people to, you know, not want to push for modernizing our health insurance system and ensuring that all people are insured. So we have to do a whole lot of work in educating our people to the benefits of that, and making sure that those people have access to affordable health insurance. And you know, yeah, no one wants to pay for health insurance. No one wants to, and so by opening it up to a marketplace and allowing people to buy in to these networks really lowers the cost, because it becomes competitive at that point. And these insurance companies want to distribute the cost of coverage across a larger network. So the competition comes into play, and you start to see that. So there's no longer these conglomerates that are just isolated and holding on to these, you know, these people. Also, the other thing, if we're able to make that pivot and make that move of individuals, health insurance should not be tied to their employee. All right. Now that's good for the employee if they're able to, you know, pay a lower monthly premium for health insurance as opposed to paying into the benefits that their employer is offering. But it also saves the employer money as well, because they're no longer having to pay part of those premiums for those benefits that they're offering their employees.
Right.
So, you know, you
It's a win-win-win-win.
could essentially grow the economy by a third if you did that. And I'll tell you why. So the employer will have more resources to be able to grow and hire more employees, because they are not having to pay those exorbitant health insurance premiums for their benefits. All right. Also, that frees up more money for those employees. Therefore, they will pump more of that into the economy, whether it's through savings, whether it's through investment, whether it's through buying stuff. All right. So you have that, and then you will have more industry growth from that as well. And you also see a potentially increase in wages without it being an extra burden on the employer, because not only will they no longer say, we'll pay you this, but we'll give you these benefits. No, you know, you're paying me this now. So that's the other thing. So you'll see an increase in wages, you'll see an increase in employment, and you'll also see an increase in you know, the economic growth from those dollars that are freed up from having that type of health insurance system.
Talk to me about the opioid issue.
I had to leave to find work. Okay.
You had to leave Eastern Kentucky.
I had to leave Eastern Kentucky to find work, and so I left, and it was in the early 2000s, late 90s, early 2000s when I left, and whenever I came back after being gone for a couple of years, like a short period of time, man, the drug epidemic, the opioid epidemic, you know, the pills just exploded back here. All right, and I mean, I came back home to find some of my friends that I went to high school with. I didn't even recognize some of them.
Right.
Okay, because they had just been ravaged from the curse of the addiction. Okay, and it was kind of like a double blow. Okay, so we had lost we were in the process of losing the coal industry. All right, because coal industry was in decline even before Obama came into office in 2008. Right. There's no secret about that. We can go back and we can look. All right, numbers support it. But we were already in that decline, and then you had the further decline of the coal industry, okay, and people were starting to lose their jobs, and you just and the chronic pain and just the illness that was here took hold, and you just had people that just fell into that cycle of addiction, looking to numb the pain, looking to erase the worry, and just trying to cope with the stress, strife, and struggle that we have here.
So the brokenness from working so hard in the coal mines and machinery and the way that our people had to make a living.
Mm-hmm.
So that physical brokenness,
Mm-hmm.
but also combining that with the psychological brokenness of not having work.
Mm-hmm.
And people were meeting those two prongs of brokenness with opioids.
And also, don't forget the other leg of that three-legged stool, the brokenness of being broke.
Mm-hmm.
I can supplement my income if I go down to Florida and get me some pills and bring them back up here. That happened. That's how you had Casper and everything come up and stuff. So you had these doctors, that were just writing prescriptions and just flooding this area with powerful narcotics. And it was in a pill form, so it was no longer cocaine, it was no longer heroin, it was nothing like that. It was a pharmaceutical grade opioid that was able to produce some powerful effects.
And the doctor said I could take it.
Yep, and the doctor said I could take it, so that's all right with the good book, and I can do it, and nobody say anything about me because it's in that little orange bottle with a white top on it.
Mm-hmm.
Yeah.
And then you're hooked.
And you're hooked.
So what do we do?
It comes back to a couple of different things. All right, we have to restore hope and dignity. All right, but in order for us to, we have to end the cycle of addiction first.
Mm-hmm.
Okay, we're making progress. It'll never be eradicated. All right, when we are in a new world, but the drug courts that we have done good work, but the one thing that we have to realize is that this is not something that going to a treatment center for 30 days is going to fix. The recidivism rate is huge. Those that return, or those that, is huge. We have to provide quality care to these human beings and treat them for the life of the addiction, and addiction is life. We have to make sure that our communities are provided with the resources to take care of these people and help them heal. And it's not by throwing them in jail and taking away their constitutional rights, and it's not by ostracizing them from the community. We have to make sure that they are loved, that they are respected, and that they have a sense of hope and are treated with dignity. Because that's when the healing and that's when the recovery truly takes hold, and you can see the change in life. There's probably, you can't name many families that haven't been impacted by the opioid epidemic or drugs, pills, whatever you want to call it. All right, in some capacity, everyone has felt it.
And in the video before this on economy, we talk about that also, about the pride of having a job.
Yeah,
you talk about that.
The dignity of it, and being able to provide for your family and stuff, and then
and having a responsibility.
Yeah, but it goes beyond the responsibility. It's whenever you are young and you have a new family and you realize that you're not going to be able to provide for your family the way they need to be provided for, and you're trying to cope, you're trying to deal, and there's no hope, and that hope turns to fear, and that fear erodes to loss of dignity. I talk about that. I've seen it happen to my friends, and I've lost some friends with the drug crisis that we have here. That's hard, but I mean, you get that call and somebody's gone that you saw 2 days ago.
Yeah.
But we have to provide a sense of hope for those that are suffering from the ravages of addiction.
How does medical marijuana tie in?
Well, I mean that's part of the solution, because so many of the people take opioids for chronic pain. All right, and there is science out there. There is medical evidence out there. There are studies out there. Medical journals, testimonials. Everything points to the use of marijuana as being a viable alternative and safe alternative, non-addictive alternative to opioid-based pain management programs. Okay.
And we've had states go ahead of us.
Well,
it's already been.
Let me get there. So you got Ohio, all right, and you have Ohio's the closest one, all right, and you have Colorado, Washington. I think there's like over 20 states have legalized marijuana. And not only has that helped them with their state coffers, all right, by providing a new revenue stream of taxable revenue to the state, but it's reduced prison, all right, it's reduced the incarceration rate, it's added revenue, and it's also dealt with reducing the addiction issue in some of these communities. All right, or some of their communities. Now, if we were to look at Eastern Kentucky and you look at the number of people that use opioids, we're just talking about marijuana in relation to pain management right now, but it has other benefits. But we talk about that. You would see a reduction in jail, all right, when it comes to the correctional system. You will see a reduction on the legal system in general, all right. You will see a reduction in 2018, 1,247 people died from drug overdoses in Kentucky. Okay, it's 2018, 1,247. That's 1,247 lives. It's 1,247 families, spouses, children. Yeah, I mean, it goes. And the ripple effect in the communities. So if we were to provide, and I'm not saying that you would save them all right, but I'm saying that goes to make a big dent in it, and we can give people an alternative to having to manage their chronic pain, and chronic pain is a thing, all right, and having to manage their chronic pain with medical marijuana. And it's wrong. It's so wrong for a person to drive over the bridge, go into Ohio, be able to get medical marijuana, and then if they come back over to Kentucky and get caught with it, they're a criminal, a felon. All right. So that's not justice.
Right.
That's wrong. And our state legislature has, and state senate, all right, has played around with the idea and toyed around with it. It goes into committee, gets stuck in committee, and then it may come out and may get voted on, but doesn't. I will make Robert Stivers not only get it in committee, get it out of committee, and get it to the floor for a vote. Because the people of not just East Kentucky, but the people across the Commonwealth of Kentucky deserve to have that measure voted on, and they deserve the right to access to medical marijuana, not just for their pain, but for their cancer treatment, for
seizures
for seizures for children, for the numerous things that the benefits of marijuana have been documented to address. And I think that it's time that we do that. And we can no longer just placate to, the whims of Robert Stivers and what he wants to do, because he has supermajority in the state senate. And we have to have leadership that's going to be in the state senate to push it through committee and to make sure that goes to the floor for a vote, whether it's in the House, whether it's in the Senate. So there.
So those are the main points for your healthcare platform.
Yes.
Is there anything else you would like to add?
Just that we need. No Kentuckian, really no one, deserves to go broke because they don't have health insurance and they can't pay their medical bills. The idea of going bankrupt if you get sick is unfathomable. And
and we're all one step away from one bad medical situation.
Yeah. I mean, it's like, and the other thing that people don't realize is that just because you have health insurance doesn't mean that they're going to cover everything. Again, it goes back to what is a corporation's number one responsibility? To generate a profit for its shareholders. And at that moment, and they're always saying, well, instead of giving them this medication, give them this medication because it's cheaper. Instead of, no, we're not going to pay for that because that could be classified as an elective surgery. He can't walk because of his knee. Yeah, but he's okay. All right. I mean, there's that back and forth going on all the time. And you can also tap out of what insurance company is willing to pay. Mm-hmm. And they will write your life off because they're not willing to pay that. That's where we are right now. And so when we talk about healthcare, it is life and death. Mm-hmm. And we have to, and there's so much to it on the backside that we don't even know.
Oh, sure.
And you hear the horror stories of those that do, and it's just like, surely it can't be that bad until you're right in the middle of it.
And it is.
And we have to be able to provide for our people and provide quality health coverage that doesn't tap out, and doesn't cost them literally an arm and a leg. Literally. Mm-hmm. So we have to make sure that we have that. No one should go broke because no one should have to face bankruptcy over cancer.
Sure.
Over a failing heart. Over a failing body. And again, it's about restoring dignity and making sure that our people have the quality of life they deserve here.
And I think we'll end it on that.
I think we will. All right, everyone. Again, this is Scott Sykes. I'm a Democrat for State Senate here in our 31st District. That makes up Elliott, Lawrence, Martin, Morgan, and Pike counties. This has been the second installment of our series. where we're talking about my platform, the People's Platform for Eastern Kentucky, and this has been a discussion on healthcare. So again, like, share, comment on the video. Let me know your thoughts. That's part of the reason that we have social media, is so I can hear your thoughts, and I want to know what you think about, where we are with health insurance. How many of you have had difficulty getting essential services covered? How many of you have fought over needing a certain prescription and the insurance company not willing to pay for it? How many of you have lost your insurance because it was tied to your employer? These are things that we need to know. This is the discussion that we need to be having. Primary elections coming up, June 23rd. People are already voting. If you haven't requested your absentee ballot or mail-in ballot as of yet, you can still do that. You can go to www.govoteky.com and request your mail-in ballot. You can also contact your county court clerk and request a mail-in ballot. You can go to your county court clerk's office and vote early, or you can go to one of the precincts that are going to be open on election day. We will be providing a list of those precincts here within the next day or two, and we will be getting that to you all. Again, stay safe, stay healthy, and be good to each other, and be kind to each other.